My name is Feng Liang. I'm a medical doctor from China. I'm New York State licensed acupuncturist and national board certified Chinese herbologist. Today, I'm here with Mr. Dan Globus, who is my marketing director and office manager, and he's going to ask me some question, and I will give my best answer to you. Some of question maybe is the first time people will question. I hope I can help.
Thank you, Dr. Liang. So the first question I want to ask you is, which health issues have you been the most successful in treating, and what are you doing differently from Western doctors to successfully treat these conditions?
Okay, there are several conditions I was treating very successfully. The thyroid disease include grief disease and Hasimoto and thyroid nodule. And another one is rheumatoid arthritis, and I can treat it very successfully treated. And hypertension, anxiety, allergies like nasal allergy, and there's many others because I practice so long, so I treat a lot of issues. And I think the difference between Chinese medicine and the Western medicine, Western medicine basically based on the evidence. Say if you have a symptom like always feel tired and you gain weight or hair loss, and when you run to the primary care physician, they will maybe refer you to the specialist. They all have to check your blood to see if your thyroid function is low or not. But a lot of people, the thyroid test come back is normal, even though they have a lot of symptoms. And once it's normal, the doctor will not give them any treatment. They just say, just go home, sleep more, rest more, and that's it. Maybe we'll suggest take some vitamin supplement or something. And until someday the blood test showed maybe the thyroid function is low, TSH is high, and then they will right away suggest them to take a medicine like a Thyroid, and then usually they will suggest a patient take it for the long term. Some people even have to take it in the rest of the life.
So do you think that the symptoms are already there before the evidence is there in the
Yeah.
blood test results?
Yeah. And the Chinese medicine is different. Chinese medicine, first of all, we like to do prevention treatment. That's the big difference from West medicine, prevention. Okay. And prevention means when you have no symptom, healthy like me, I will do, thanks God, I studied the Chinese medicine. I know how important prevention is and how to do it. People thinking prevention is a good idea, but they do not know where to go, where to find help to do the prevention. And when a person develops a disease like what I said, fatigue, hair loss, couldn't sleep, and gain weight, that's the sign of your internal organs has a problem, weakness. For the hypothyroid, basically it's a weakness. And then you should, Chinese medicine will based on those symptoms and look at the patient's tongue and the pulse, and then to diagnose which organ is weak and what kind of a reason caused it weak. As we know, thyroid problem is caused by the stress. When people have a intensive long-term stress, eventually ending with the thyroid problem. That's because stress can eventually lead into autoimmune disease. So we have to find out the reason and then to treat the reason, treat the cause, and then people can recover. I help people. Most likely, I help people already have Hasimoto disease, hypothyroidism. Some people even start to take the Thyroid medicine. They come to me. I will help them to getting better. It's not means you take a Thyroid. Most people take Thyroid in the beginning, they do feel better, but after a while you take it, you will not feel so good. That's why people seeking for other treatment. So I will help them getting better first, and then to help them taper off the Thyroid medicine. And then that can be tested by West medicine. You can, after a few months, you can check your blood again, and the blood can be normal.